What does informed consent for a stimulant look like? My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and I'm going through a series where each day I go through one of our different psychiatric medications and essentially go through the informed consent process as I would with one of my patients. So today we're talking about stimulants, and stimulants are our go-to first line medications for ADHD. They have some other indications, but it's most commonly prescribed for ADHD. So there is off-label use for treatment refractory depression. We usually think about this in kind of atypical populations. So maybe someone with a terminal illness or someone with really severe psychomotor slowing and neurovegetative symptoms. Vyvanse, or the long-acting version of Adderall, is also FDA approved for binge eating disorder. And so it can be used for that purpose. Although these medications can be very effective for some individuals, they also have potential risks, and there are cases in which it's not appropriate. As far as common side effects, this could include things like a decrease in appetite as well as GI upset. So that could be nausea, abdominal pain, diarrhea. There can also be headaches or a worsening of pre-existing headaches or migraines. There can also be insomnia, as well as effects on mood and behavior. So it can cause things like irritability or agitation. It can also, in some vulnerable individuals, trigger mania. The last major cluster of side effects that we are concerned about is the cardiovascular ones. So it's a stimulant, so it's going to increase your blood pressure and your heart rate. And in vulnerable individuals, they could be at risk of triggering an arrhythmia or other cardiac issue. And stimulants are controlled substances. And so the other concern is going to be about potential misuse or abuse. So these medications can be taken in excess to get a high, or they can be mixed with other things to get a high. They also have street values. They can be sold for money, or they can be taken by people who don't have ADHD in order to enhance performance academically or otherwise. So the only real contraindication for a stimulant is probably going to be if someone has a cardiac history that would put them at severe increased risk with taking a stimulant. If someone does have either a personal or a significant family history of cardiac issues, especially sudden cardiac death, then it's necessary that they get an electrocardiogram to look at their heart and how their heart beats to make sure that there's no underlying issues going on. Palpitations can also be a common side effect of stimulants. And so if this is occurring, it's important to get an electrocardiogram. Other patients for whom a stimulant might not be a good option could be someone with active substance use, especially if they're taking other stimulants like cocaine or methamphetamine that could interact with the stimulant, as well as patients who have a history of bipolar disorder, because like I mentioned, these patients are going to be vulnerable to having a manic episode triggered. And then lastly, there's the patients who have eating disorders. The stimulants can be used to suppress appetite. And although, like I said, Vyvanse is FDA approved for treatment of binge eating disorder, it may not be appropriate in other individuals, especially those who are underweight and may be at increased risk of cardiac issues. One of the relatively nice things about stimulants is that they have a very short half-life. So there are shorter acting versions and there are longer acting versions, like I mentioned. But once they're out of your system, they're no longer having a physiologic effect. So these medications can be taken as needed. They can also be taken every day. But as far as a withdrawal syndrome, that's fairly limited. Now, people may have some withdrawal effects if they've been taking it every day for some time, but they're usually relatively mild and limited. So this could include things like essentially the opposite of the effect of the drug. So brain fog, fatigue, drowsiness, increased appetite. There can be mood dysregulation and feeling severely depressed and sometimes negative thoughts associated with that. There is also the risk of tolerance with these drugs, which means that over time, the same dose of the medication becomes less effective. And so you need to increase the dose to get the same physiologic effect. So the only way to mitigate or reduce this risk is to take the medication as little as possible. So I generally recommend taking drug holidays on the weekends or when you're on vacation, or just taking the medication as needed to limit the exposure. So after going over all of this with a patient, we would talk about whether or not the benefits of this medication outweigh the risks and go from there. If you have any other psychiatric medications that you want me to go through an informed consent process for, then put them in the comments below. Wishing you all good mental health, and I'll see you in the next one.